Hello, my name's Chris Mace. Let me shake your hand. I'll be conducting your cardiovascular exam and peripheral vascular exam. Can you pan the room, please? All the way around. Okay, I'm going to be inspecting your neck first. So I'm going to be shining a light here, and I'm looking for your carotid pulsation and jugular vein distension. So yep, turn your head that way. And I'm looking, I see carotid pulsation, no jugular vein distension. Over here, pulsation, no distension. I'm also going to check for the point of maximal impulse, which is the mitral area, fifth intercostal space, and I'm looking for pulsation there. And yes. Okay. Next, after inspecting there, I'm going to actually be palpating. I'm going to be pushing on areas here. Starting with your neck, the carotid area again. I'm going to feel for the pulse, and in this, I'm feeling for a thrill, which is at high turbulence, but I don't want to feel that, actually. It's just a strong pulse there, no thrill. Okay, then I'm going to move my way down to your sternal notch. Your manubrium connects to the rest of your sternal body here, and right up here, that's where it connects the angle of Louis. And I'm going to move over to the right to the second intercostal space, and I'm going to feel for a point of maximal, or not point of maximal, but a pulsation here, your aortic pulsation. I'm going to move to the left side. This is your pulmonic pulsation in the same second intercostal space. Go down 2 spots to the fourth intercostal space on the left, and that is your tricuspid. I feel that. Down to the fifth, and under nipple mid-clavicular line, I'm feeling for the, right there, the mitral pulsation. All right. After that, I'm going to move right into auscultating or listening. And when I listen, I am going to start at your neck again. I'm going to start at the bell side of the stethoscope. And with this, since I'm listening, I don't want to hear your breathing. So I'm going to have you hold your breath so I can actually hear the carotid pulse. Can you hold your breath for me? Good. Then I'm going to move into those same areas I was at, palpating, but I'm going to listen with the bell, the aortic. And what I'm listening for in these same areas, pulmonic on this side, is I'm listening for the rate and the rhythm, going down to the tricuspid. And a normal rate is 60 to 100 beats. Your rhythm, I want that lub-dub sound. Any extra sounds I don't want to hear, but those sounds would be murmurs. I'm going down to the mitral area again here, point of maximal impulse. Murmurs, S3, S4 sound, and clicks or rubs. Those are just additional sounds that you don't usually want to hear. All right, I'm going to do the same thing with the diaphragm side. Aortic. Strong. Pulmonic. Tricuspid. And mitral. Strong lub-dub sound. Okay. Next, what I would be listening for is I'm going to have you turn onto your left side. I'm going to take the pillows out. And here, I'm going to listen along the left sternal border. And again, I'm listening for rate, rhythm. The extra sounds that I'm going to be a little more attentive to here would be the S3, S4, and mitral stenosis. Okay, sounds good there. What I would have you do next is sit up. And with sitting up, I'm going to have you sit up and lean forward. Now, when I listen to the same spots, the left sternal border and the point of maximal impulse mitral, I'm going to have you exhale. What this is, go ahead and exhale. Again, okay? And again. I'm listening specifically in this position for aortic murmurs, and I did not hear that. Again, strong lub-dub sound. What I'm gonna do is have you sit back or lay back down. That actually concludes the cardiac portion of the procedure. Okay. And now I'm gonna move into the peripheral vascular, which is your arms and your legs. Okay. So first thing I want to do is I want to inspect. So I'm going to look at your arms and legs. First, your arms. I'm going to look for size, symmetry, swelling, skin color, nail bed color, and venous patterns. So just to see what your veins look like. And I don't see anything that stands out as far as abnormalities with veins at all either. Good color, all that. Then going to your legs, looking at your legs, I do the same thing, looking for those same features. But on top of that, I'm going to be looking for hair distribution, pigmentation, and any scars, ulcers, any scratches, rashes, anything like that, and looks pretty clear. Going from inspection now, I'd move into palpation. One other thing I want to do before we move on to palpation is I want to inspect your legs for varicose veins. The way we do that is we actually stand up. And I'm checking down here in your legs for any varicosities, and again, there's nothing at all standing out. And being active, you probably wouldn't have that. So now you can lay back down. Okay, so palpating, this is where I'm going to actually be touching again. And the first thing I want to touch and feel for are pulses. I'm going to start with your arms, all right? Arms, I'm feeling for radial pulse, and that's strong. It's anywhere from 0 to 3. I'm going to rate that a 2 plus. Good pulse. And then this is your brachial, and that's usually right at the bicep tendon, and that's also a 2. We'll go over here to your other wrist, radial. That's strong too. That's a 2. Okay, after pulses, we would move into nodes. The nodes I'm looking for, I actually don't want to find. So I'm feeling here around your elbow for epitrochlear nodes. I don't feel them there. And then over here, nothing on that side. Okay, so pulses, nodes, and then looking for other things in what I'm feeling for in your arms would be your nail bed. So I'm going to look for capillary refill. So what I'd be doing is I'd pinch your thumb, finger, and I'm looking for, I'm pinching, it goes white, and immediately it turns pink, so that means he's perfusing well all the way to his fingertips. And that is your arms. Moving to your legs for palpation, we again would start with pulses. Pulses in your legs would be here at the femoral, then popliteal, posterior tibialis, and dorsalis pedis. So we'll start here with femoral. Yeah, that's strong pulse there. And then in your groin on this side, strong 2 plus there as well. And then popliteal, we'll go back here. That's a 2 plus. And then on this side, behind the knee, popliteal, 2 plus. Posterior tibialis, I like to go behind that ankle. 2 plus. 2 plus. posterior tibialis. The right foot, that's strong. 2 plus. Strong 2 plus there. Okay, so that would be your pulses in your legs. Next would be the nodes again. And your nodes. The nodes I'm gonna feel for would be up here in your inguinal groin area. What I'm doing is I'm just feeling circularly for any lumps, bumps that shouldn't be there. Nothing. Okay. After nodes, what we're doing is we're again looking for capillary refill, and that would be in your toes this time. And I'm pinching. Good refill. Your toes are a little chilly, but the blood is refilling. Good. Okay, after I feel for or look for capillary refill, I'm going to be feeling the temperature of your legs. So I'll use the back of my hands. They're warm up in that area. Then I'm gonna work my way down. Warm, and then down to the feet. So this is where it does get a little chillier than the rest of your leg, but it's still semi-warm. It's not too cold. All right. So after temperature, I'd be looking for edema in your feet. Now, actually, this would probably be better if you sat up. Looking for swelling in your lower part of your lower extremities. So I'm looking for in the shin area, the ankle, and the feet. Now, with the ankle area, specifically the medial malleolus. So there's obviously, just in glancing, there's no pitting edema here, here, or here. If there were, I would be pressing to see how much indentation I'm making, how long it takes for it to decompress. But you have none of that, so that's very good. Shows good circulation all the way up to your feet. I have 2 final tests. One is the Allen test, and that's going to involve me holding your wrists, both wrists. I'm going to do one at a time. What I'd like you to do is I'd like you to make a fist. I'm going to occlude both the radial and ulnar artery. And then I'm going to have you release your fist, and then I'm going to release the ulnar side. And what I'm looking for is refill of the hand and coloration coming, which it is already. And I'm seeing veins start to bulge. So we'll do it again, but I'll release the radial artery this time. So make a fist. And then release. I release the ulnar side. And we are starting to see veins bulging back out and color return there. We'll do the other side. Fist. And release. And I'm going to release the ulnar side this time. Okay, we're already getting that fill here and color. One more time, fist. And I'll release the radial side this time. And color and refilling of the veins. Okay, the very last test I have is an arterial insufficiency test for your legs. So I'd like you to lay back down. We're gonna raise your legs up 60 degrees. I'll hold them upright. And then, after about a minute, but we only have to do it for about 30 seconds here for time's sake. Once we're done here, I'm gonna swing your legs down. You're gonna sit up, and I'm gonna watch your feet. I'm gonna look for these veins to refill, as well as color return to your feet, because right now it's kind of draining the color away from it and the veins are flattening out. So we'll give it another 10 seconds or so. And right about now, let's do it. Sit up, and I'm gonna look here, and I'm watching for color return, which I'm already seeing it starting to come down, and your veins starting to bulge back out. Same with this side. Yep, veins popping out. Color returning. That concludes the exam. Thank you.
Thank you.
What's that at?